You know, when problems like earthquakes or cholera or Ebola are not in our models, it means that our models are wrong, not that, I was saying today, the pathogens aren't trying to win an argument with us. And pathogenic forces that President Clinton mentioned as well. We have to keep up with them, and philanthropy has helped us, indeed made it possible for us to do this work. So it's been all driven initially by the generosity of private citizens. And as was said earlier today, and when we're lucky, and in Rwanda we've been lucky, not because the improvements there are the result of luck, but because they have endorsed policies, as you said, Steve, where they invest in building strong systems, our partners in government. But, you know, Bill and Melinda, I don't know, where's Bill sitting? I do want to say one thing. I'm allowed to do personal anecdote. I was lucky enough to meet them as they were launching the foundation. We've been friends ever since. Our families are friends. It's awfully fun to travel with Bill Gates, I will tell you. You know this, right, Warren? I'm on a mountainside. I said, well, we can go visit the clinic, we'll go visit the hospital, but you know, we're going to go see the gorillas, Bill. You know, I know your son has worked on this. So we go up to the top of a mountain, straight up, and we're sitting there. There's this beautiful silverback gorilla sitting not 5 feet from Bill Gates, and he turns around to me and says, now where were we talking about the tuberculosis vaccine? I kid you not. All right, President Clinton, can I make this up? He's talking about the lipid content of the mycobacterium and whether or not it will make getting a vaccine together. I said, there's a beautiful spectacle. It's like God is present here. A whole family of gorillas. No, he's working still on global health. Not an exaggeration. But really, I hope that you'll tell Melinda that we talked about, not just, she was very amused. She's got the EQ in the family. But what you two have done, what you've done, President Clinton, to elevate our endeavor, which is an endeavor around equity, around justice, around making it less possible for people to die because they're poor and sick, giving everybody a chance. Global health investments in health have been a huge success over the last 20, 30 years. Plummeting infant mortality, plummeting child mortality. Yes, we have a long way to go, and there are more complicated questions, but it's been an amazing thing for, as you said, someone who grew up in rural Florida, not in the most, I was lucky I had an intact family, and you know my whole family, but it wasn't at all obvious that I would go from Duke to Haiti to Harvard and still be able to do this work full time. And that's thanks to people like Bill and Melinda and President Clinton. We're now going to be launching with our Rwandan partners a university, because people want to go to university, just like I wanted to go to university from a little public high school in Florida. I wanted to go to university. I wanted to go to medical school. And all of these young people who survived these trials and tribulations that took out previous generations, you talk to them when they survived childhood and when they're in high school, and they're all going to tell you, I want to go to university. I want to have a business. I want to be a professional. It's a big part of what we'll do going forward. Steve already mentioned what happened at University Hospital last week. And let me tell you, boy, when those triplets were born on November 24th, I thought, well, this is why we built this hospital, to take care of really tough cases. And to have a Haitian surgeon, Henri Ford is his name, he's a dean in California, University of Southern California. He's a dean. Came from a poor family in Haiti. Went to Harvard Medical School and is now a dean. Going back and serving there and training people year in, year out. It's great. There are great people in global health. And I'm so proud to head back to Haiti and know that these children are okay. Donna, you were a great Secretary of Health and Human Services, and thank you for introducing me to the boss, Chelsea too, Secretary Clinton as well. I do want to close by saying to Bill and Melinda and to President Clinton. Thank you, the three of you, and others who work with you, for believing in this cause of global health equity, the tough things, how to take care of people already sick with AIDS, how to keep care of people sick with drug-resistant tuberculosis when the price of medications is through the roof, how to make sure that people who are hit by a car, as I was during medical school, you know, nobody leaned over me in the street in Cambridge, Massachusetts and said, should have looked both ways before you cross the street. I got taken to the Mass General Hospital, had orthopedic surgery. You got orthopedists in your family. And that's 30 years later why I'm standing here, because I had medical care when I needed it. And the only thing I ask in the rest of my life is to continue being able to prevent problems, but to respond to people who are sick with illnesses or other catastrophes as a physician working with a very large team. Thank you all very much.